If you're considering non-surgical aesthetics treatments, picking the right physician plays a very big role. While positive outcomes may leave you feeling younger and more confident, ending up in the wrong hands may leave you feeling more than just dissatisfied. Let's take a look at what Dr. Anushka Reddy has to say about that.
Regardless of the medical speciality or the level of training your doctor may have, there are certain aspects that you should look into before scheduling a medical aesthetics procedure. Due to the increased demands and perceived lucrativeness of this practice, many general practitioners and specialists have started offering cosmetic treatments as part of their practice, leaving patients feeling overwhelmed with choices. Published author in consumer publications such as Longevity, Woman and Home, Health Intelligence, Fair Lady, Dr. Anushka Reddy is frequently called upon by the media to comment on current affairs and issues with aesthetics, making her a highly recommended provider. She is a trusted doctor with high standards who has traveled the world searching for the latest age-defying techniques, reassuring her patients that they are all in good hands.
The procedures I mainly do at my practice involve the use of Botox and fillers, and I offer advanced facial contouring at my office. I like changing patients' faces to project the best that they can to the world. In addition to cosmetic procedures, I also offer botulinum toxin to treat axillary hyperhidrosis, which is actually a medical condition. This is excessive underarm sweating, and most people don't know that there is actually a treatment for this. So Botox has been used very effectively and is FDA approved to treat this medical condition. The right time for someone to start with these procedures is whenever they feel their expression lines are becoming apparent, and especially when they see expression lines there when they are not even expressing themselves. So before that, those lines actually start, I would suggest that you consider treatments. First-line treatments would be Botox, obviously, because they're quick and easy to perform. And then second-line treatments would be dermal fillers, followed by, obviously, chemical peels and maybe laser treatment or two. The question regarding who is reputable has become a hot topic in South Africa. What's happening with aesthetic procedures is that there are many medical practitioners, including dental practitioners, offering these procedures. However, we are doctors at the end of the day, and we are governed by the Health Professions Council of South Africa. So it is imperative that we actually abide by the rules and regulations. The most important rule, I would say, is that these procedures, being medical in nature, need to be done in a doctor's office. Having these procedures done at a beauty salon or at a nail bar or at a hairdresser, that's what I've heard recently, is an absolute no-no. There are complications associated with these procedures, and naturally you need to be in a medical environment to deal with these type of procedures. If you want to go and have your teeth whitened, you would go to a dentist naturally. So it makes perfect sense that if you want to have Botox done, you would go to a doctor in his office. Complications that can arise if you go to someone who's not experienced with these types of injections are profound. We're noticing worldwide that we are seeing more cases of blindness. Now that's an extreme complication, I must admit. In South Africa, thankfully, doctors are quite conservative, so we don't experience these type of complications. But especially when injecting tissue fillers, there is a risk of actually blocking major blood vessels. And the blood vessels that we are most concerned about is the supply to the eye. And once these complications arise, they are permanent. So don't think that if you have your nose tip enhanced, that there's no risk of actually having these complications arise. It's imperative that you go to a doctor who's experienced and who understands their anatomy pretty well. And my advice to patients who see me is that it's always good to ask doctors, and it's not seen as rude. How many years of experience do you have? Do you have a before and after a gallery of photos? And you can then gauge if this is the doctor you want to. And another word of advice is don't ever feel pressurized into doing any treatment. I feel that these are medical procedures. They need to be considered carefully before actually having them done on oneself. I've been practicing aesthetic medicine for the last 13 years, and I've done over 10,000 procedures. I have a pretty good relationship with my patients. I've had minimal complications, although complications do happen to the best of injectors. I love what I do. I'm passionate about what I do, and I think the results that my patients experience are pretty good. Although I don't really like to force my idea of what is beautiful on patients, I do have a keen sense of what would make someone attractive. And I do use a formula at my office. So I would certainly advise a long-standing patient of mine who's had numerous procedures with me to stop. I think it's very important that I do that, simply because they're a walking, talking advertisement for who I am, and I don't want other people to be scared by what they see. So if someone I feel is looking good enough, that's enough for me.
Oh my goodness, I still can't get used to the idea of anyone placing a needle anywhere near my face. But if you're going to do that, make sure that they know what they're doing, and don't get your Botox done at a hair salon. Dr. Anushka believes that the best cosmetic outcomes are natural and enhancing, ultimately improving the patient's sense of self and well-being. For more information, follow Dr. Anushka Reddy on Instagram as she gives you the latest updates in aesthetics cosmetics. Next week, your beauty guide continues as we take a look at the long-term cosmetic benefits of Botox, and make sure you tune in. So don't go anywhere, because after the break, we're back on the couch with TV personality and entrepreneur Ayanda Tabete.